Today's date is July 5th, 2016. We're here with William and his lovely wife, Janet, and I have your permission to video
you do.
and post you, correct?
Yes, you do.
And I have your permission to video and post you too, correct?
Yes.
Okay. William's story, and he was brought by Janet,
That's right.
is that he has a prostate issue. He dribbles. It takes him up to 30 seconds to get started. This came out of the blue.
Hi, world.
Hello.
Hi, world. Anyway, well, this is real life, you know?
Yes, it is.
All right? Women have their problems. We have our problems. So, this came on slowly. No one's been able to help you. You've tried every prostate remedy under the sun, right?
Mm-hmm.
You've done everything. You happen to eat a really good diet. You have looked after yourself. You're a rare patient. You've done just about everything right. And your sexual functioning is still good, but it's the urine issue. And your PSA was high. Your PSA spiked in 1 year threefold or fivefold. It went up to 6.7.
Yeah, the first year it went to 4.8. I brought it back to 2, and then it just recently it was 6.2, and then I brought it back down to 3.7.
And you did that with diet largely,
Yes,
right?
largely.
Eating a good, clean, wonderful diet,
Yes,
right?
yes.
Okay.
And a lot of supplements too, just to make sure.
And your wife brought you to me because she wanted me to inject your prostate,
That's right.
right?
Mm-hmm.
Now, before I went to your prostate, where did I go?
I went to my gums,
Your mouth.
my teeth, yes.
And I did a really intense search, and I looked at open your mouth. And the viewer can see that he's got some gold, and he's got wisdom teeth out, and he's got a couple missing teeth that are very visible. And I checked them, and they all checked negative. And you were very skeptical about muscle testing, weren't you?
No, I've had kinesiology kind of done before,
Okay.
but it just didn't seem like you were giving it your all the first time.
All right, and then we checked tooth number 9. We checked tooth number 9, which is this tooth
This tooth right here.
right there.
Yes.
And that checked positive, which was a shock to you. And I just got done injecting it with Procaine.
Yes.
And you had very weak muscles when you touched that tooth before, correct?
Mhm. Yes.
All right, so now we're going to have your wife video me. It's still videoing. Keep your elbow straight. Now go ahead and touch that tooth. It was very weak before, right? Hold.
It was. That is stronger.
Isn't that stronger?
That is
Okay.
stronger.
Now, when I did it, there's no doubt you were skeptical, right?
Absolutely.
And you say that is stronger.
Yeah, it's stronger.
No doubt.
Yeah.
All right. So I also checked you down here, not getting personal, but this is spots I use for a disturbance in the pelvis.
Okay.
All right, keep your elbow straight.
Okay.
Elbow straight. That's it. Hold. I really laid into you with my weight. And if you recall before, you were weak enough that I could almost bring your arm down with my baby finger.
Mm-hmm.
Right? And you're catching all this, aren't you?
I am.
Okay. So you notice a huge difference, don't you?
I did notice a difference, yes.
Okay. Big time difference. Okay? And what happened was we injected tooth number 9 and you got stronger just touching it, so that took that out of the circuit temporarily. And it also took off the heat from down here temporarily. Now I would be curious, I know you just urinated and you told me you were dribbling and it took you about 30 seconds. I'm tempted to send you back right now to see if you could get any type of stream right now.
I did drink 4 cups of water sitting here waiting for you today. So
Good.
I
So
would
go ahead.
figure,
Now we're not going to video you urinating, okay?
I appreciate
But
that.
we're going to video you when you come back.
Okay, I hit the red button.
Yeah.
How-
So the wife says.
So how was it, baby?
Well, it still took about a little while to get started, but then it did actually become like a better than it was before. Not great, nothing like where I'm standing in a urinal at a gas station, some young kid comes in and just roils the water. that didn't happen, but it was better than the one before. There's no question
Which was
about
only, what, 10 minutes before? Or
it. Just
And
taking
then
taking a piss?
That was
And
about
you
10
just
minutes
taken a piss 10 minutes before, so
Yeah.
that means there was not that much volume in your bladder, and I would not expect a big stream.
Yeah, but it
There
was
wouldn't
it
be
was
one
no
in me.
there was no question that it was better.
But if it was
and
no-
then it stopped. It went for about 30 seconds, and then it stopped and just sort of reverted to its old, dribble. But it was better than it was before
Good.
for the first half.
Okay, so you're satisfied something did happen with your urinary
I
function.
just have to admit that to myself. Yes. That's
Okay,
something.
hard to admit, huh?
No, it wasn't that hard. I would like to get healed, so I'm keeping a positive mental attitude here because I want this to work.
Okay.
I actually really do. I don't want to come in here and pay you to do something that I don't think is going to happen.
And,
Really.
And interestingly, I want the viewer to know you guys came to us from Alabama, correct?
That's right.
That's right.
And your lovely wife, you brought
That's
him all the way here
From Alabama.
to see me from Alabama.
That's right.
It's an honor.
Oh, thank you.
What do you think of what you've seen so far?
Oh, I'm totally a believer. I'm into it. I believe we are fearfully and wonderfully made, and that there are connecting lines and dots, and you've learned a lot to help us understand the
So-
dynamics.
So come on over here. I'm going to get both of you while I talk. As I told you, I think that you have an interference field up here. It's disturbing your kidney bladder meridian, which controls the prostate. Yes, I know you came here for me to inject your prostate. I can do that, and I told you when I find an interference field, I usually don't do anything until that's taken care of. Because you came from out of town, I told you I'm willing to compromise a bit. And what we decided was, instead of sticking a needle into your prostate, we would do a very simple injection that can get your pelvis, and that's a suprapubic approach right there, which is not deep. It only touches the pubic bone, and we can put some ozone gas in there, and that can help. I mean, even though it might be coming from your tooth, I think there's inflammation in your prostate.
Oh, there's
To me,
my
there's-
prostate feels like it's the size of a lemon.
Yes. There's no doubt to me that there's inflammation in your prostate. So I think it's a good idea to go ahead and do that treatment. But where does the inflammation come from out of the blue? I know that you didn't mess around with anyone else.
Yeah.
So you were with your wife. So where does an infection come from? It didn't come from her, didn't come from someone else. In my opinion, it came from here, and that's disturbing your body. Does that make sense? Okay.
It's surprising to me that something could be that disturbing when I feel nothing there. There's no, sense of pain at all. I've had this bridge work here. Well, I've had this tooth knocked out for 56 years.
56 years, that's the point. The tooth was knocked out, and it might not have been treated properly at the time, or it might have been treated properly for their standards,
Right.
but not for what we know today. And if a little bacteria got in there, or the periodontal ligament was left, you could have an infection, and it's called a cavitation.
Why wouldn't an infection? Every time I've ever been infected, it hurt like crazy.
This is very interesting. It's the opposite. The less a dental disturbance hurts, the more problematic it can be for the rest of the body. If it does hurt and you are having a local inflammation here, that means your immune system is trying to contain it right there. And if you don't have that activity right there where it's going on, then the immune system is not containing it properly. This is at least how we believe it could be. And you can ask a biological dentist about this, that because you don't have the pain and inflammation there, that an infection should happen, it's sitting there festering and it's disturbing your neural circuits. And you might be better off if you could feel it.
Wow.
That's the way they explain it to me.
Wow.
All right, so we can go ahead and do your local treatment
Okay.
if you like, okay?
Okay.
Good. I just discovered you're in the Musicians Hall of Fame in Nashville.
Yes, I am.
And you're a guitarist.
I am a guitarist.
What an honor that you'd come. Now, for the viewer, I did a rectal exam on you, right?
Yes.
And I didn't feel any nodule. I didn't.
Hey, world. It was like Star Trek because he had gone where no man had gone before.
I'm glad to hear that.
Okay.
I'm
yes.
glad to hear no
That's
man
right.
had gone there before.
So am I.
All right. So I didn't feel it, and we wanted to check for cancer or nodules. You know, I can't tell you that you don't have cancer, but I didn't feel any nodules.
That's great. I'm very
And then-
encouraged by that.
And then after we injected this, we've already recorded that, correct?
Yes, I
That-
believe
that-
so,
that there was
yes.
no, that
Yes.
you had a significant change.
There was a change, yes.
Okay, really good. All right, so we can go ahead if you want, and we can do a standard blood ozone treatment on you, and we'll see how you feel with that.
Let's do it.
Thanks.